Hi, everyone. My name is Lacey Callahan. I am the Business Development Director here at Cedar and Cedar Ridge at Bethany. We are here today with our Clinical Director, Melanie Johnson. Melanie is the Director of Clinical Services at our Cedar Ridge at Bethany location, which is the campus that is home to our adult and our geriatric inpatient programs, in addition to our intensive outpatient and partial hospitalization programs, which basically just means all of our outpatient programs as well are here at our Bethany location. And so Melanie kind of heads up the clinical space over there, and we wanted to take a few minutes today to specifically talk about senior adults and more specifically the unique mental health issues that senior adults are experiencing, especially right now in the time of the COVID-19 pandemic. We have and we serve a lot of senior adults who reside in long-term care facilities, nursing homes, assisted living facilities, places like this, and they have been deeply affected by the COVID-19 pandemic for a lot of reasons. You know, one being that they are very medically fragile and tend to have a lot of underlying factors. And so the virus can tend to be great for them. And also, as a way to prevent the spread of the virus, many nursing homes, especially here in Oklahoma, and I believe around the country, are still on a lockdown status. Lack of a better phrase, which means that their residents aren't allowed visitors at all. And so we know, and we have seen firsthand in some of our patients, that this has had a profound effect on them from a mental health standpoint. And so we just wanted to shed light on that issue, and that's what we're here to talk today about with Melanie. So welcome, Melanie. Thank you for joining us today. And I'm just going to go ahead and begin by asking you a few questions. So what types of issues are you seeing as the clinical director in our senior adult patients, specifically the ones that are coming to you from nursing homes or long-term care facilities?
Hi, Lacey. Thanks for this opportunity. We're certainly adjusting to newfound normals here. And on our gero population, we still the anxiety and depression like everyone. However, we have additional issues we have to deal with memory issues, dementia, and you wouldn't think as much, but we still have geriatrics that are trying to self-medicate and cope with some alcohol and drug issues as well on the unit. We had one lady who just got in the car and drove from another state. So people have different ways to cope and they're scared.
Right. So, you know, now that as a state, we're entering into our phase 3 or a third phase of reopening, which means that slowly but surely the rest of the state is really kind of creaking back to life, and most businesses are opening up, and a lot of our precautions and lockdowns are being lifted. However, we know that in long-term care facilities and in nursing homes, that they're still restricted from having visitors. And, you know, we're going on like three or 4 months now that they haven't been allowed to have visitors come see them. And so how do you see that? And just the COVID-19 virus in general, how do you see that affecting the seniors that we're treating at Cedar Ridge at Bethany?
Yeah, so it's for sure taken a toll, and, you know, we grieve for those that have been lost in nursing homes, and nursing home staff have had to step up with big hearts and enduring spirits to kind of take over that family role. However, it's never the same, right? When someone's checking on you that you see weekly, and we've seen the pictures of granddaughters standing in the window showing grandpa their wedding ring and holding signs up just to communicate and feel connected, because when we're connected, we're protected. So, you know, we see that here, and family, again, because for safety reasons, we don't have visitation. So we're allowing family to reach out more often. We are touching base with family more often. We have more phone calls and just trying to maintain any connection we have, because families fearful on top of it when they can't see their loved one and check in with them. So I know in nursing homes too, they're allowing FaceTime, they're bringing in the computer to do calls because they know the importance to just stay healthy is to be able to have contact with family.
Right. And so, you know, more specifically to what we're doing at Cedar Ridge at Bethany, you know, what are we doing? You mentioned, you know, making accommodations for families, but what are we doing specifically to meet the needs of seniors that are struggling with depression, loneliness, anxiety, or other mental health issues that seem to have been exacerbated by the isolation and social distancing that has come with COVID-19? What types of treatment, what types of groups are we doing with our senior adult patients?
Sure, so they get a lot of groups. They have 2 nursing groups, and a lot of those nursing groups talk about the fears with COVID and what's real and what's not, and how we can be part of prevention and education. We touch base in our therapy groups with them as well, and how to reduce anxiety and how to do things you enjoy. And here we'll bring them puzzles and painting and find a leisure activity that can help fill some space, because when you're bored, that's when loneliness and depression can creep in, as well as anxiety. So we do rec therapy every day. So that's helping with that void and letting them remember what was fun. With our individual services, we talk about those anxieties that they have and the depression and how to get it out, how to communicate, how to reach out. Can we increase your support system? Do you have a connection with the church that can also be support to you? Do you have other family members that you can reach out daily to have additional support other than family who's normally filling that void with visitation? So just really going over communication, safety, breaking down what's real, what's not real with COVID, because some of the things that they come in with is false information. So lots of education, individual, group, rec therapy, nursing groups we're finding very helpful. There's a lot of med management, which will really stabilize and be able to learn some new coping skills and communication.
Right, absolutely. So, you know, you talked about, you know, the types of treatment and programs that we're offering to senior adults, but what types of tips or sort of advice can you give to family members who are also, you know, struggling with not being able to see their loved ones? What is some advice for staying connected with their loved ones can you give to the family members?
Sure, they're struggling too. So while they're here, we've, you know, enhanced opportunities for connection. And then when these elderly return to a nursing home, send pictures, send cards. Some of these elderly are returning home to families. And so families still feel like, what else do we have out there? So we have a program called the Next Step Program. That's an IOP or PHP, intensive outpatient or partial hospitalization. And that program continues the work they've done here. It gives them half a day of group treatment to keep them focused, to keep them on track, to start their day in a mentally healthy way. And so those groups work on coping skills. They address anxiety, they address depression, they address trauma. So that is a great opportunity for families to take advantage of for their loved ones. And some going back to nursing homes also have the ability via Zoom, they don't have to come in person, to log on and access our Next Step program and also benefit from that help in that program.
Right. So you mentioned there at the end talking about Zoom and being able to participate in our outpatient programs virtually. You know, for a lot of senior adults, that word virtual or telehealth may seem kind of, they're not necessarily, you know, tech savvy as a whole. And so, you know, is it difficult to participate that way? What's necessary? How can we get nursing home residents to participate in those programs virtually?
Sure, so it's easy peasy. And one thing I do, if somebody's interested, I literally take them over, show them the program, show them what's going on, where telehealth is set up, and how easy it is to log on. Family members can log on for them and then give them the privacy. Nursing home staff can help them log on in a private place within the nursing home to have that. And it's set up for them. They're one click away from being part of this group. And there's
Gotcha.
several on
So
telehealth right now. It's not
Good,
difficult
good.
at all.
Good. Well, I understand that you are going to be presenting in July 16th, to be exact. You're going to be presenting a continuing education seminar specifically for licensed therapists, but open to any and all who work with senior adults in the healthcare arena. And so you're going to be kind of getting further in depth with ways to help seniors cope, especially with the sort of results and things that have seniors are facing as a result of COVID-19. So can you talk a little bit about things you'll be going over or presenting on during that presentation?
Absolutely. I mean, our most common disorders are anxiety and depression. So we're going to cover those, but also look at how anxiety and depression has been, exacerbated during this time, and specifically focus on our seniors, like we were talking about, and how fear was elevated for them, how lack of connection affects our health, and ways to reduce anxiety and depression, not only in the patient, but in caregivers that have really struggled through this as well.
Right. Yeah, that's a huge piece. It's not just helping seniors cope, but helping the caretaker take care of themselves. That's a huge piece. Yeah. Well, great. So thank you so much. I think that's all the questions I have, but I did just want to, again, let everyone know that we are hosting a CEU, or a continuing education seminar, on July 16th. I believe it is at 10 in the morning. It's free. It's open to any and all who feel they could benefit from this type of training. If you're interested in participating, all you have to do is follow us on Facebook at Cedar Ridge at Bethany. You can message us on there and just let us know that you'd like to attend. Or you can reach out to our facility by phone at 405-605-6111. You can ask for myself. My name is Lacey. I'm the Business Development Director. Or you can ask for Melanie. Melanie Johnson is the Director of Clinical Services. So we are here. We invite anyone to participate, and we're offering this as a community service to really help our seniors who are struggling access the care and get the help that they need during this time. So Melanie, if you don't have anything else, I will let you go. Thank you so much for your time today, and we will talk to everyone soon.
Thanks, Lacey. Well wishes to everyone.